Hello, my name is Anne Winfrey, and I'm a nurse practitioner with specialty in psych student, and I am here today to present my integrative therapy video. So I'm going to give a brief overview of my case. It's about a 17-year-old African American female who was brought into the emergency department by her parents. Who stated that patient has been feeling like she cannot cope with all the pressure from school and her friends for the past 12 weeks. The patient broke up with her boyfriend approximately 12 weeks ago, which is when all of this started. Since then, she complains she cannot sleep. She gets only about 3 hours of sleep at night. She also said she has lost about 20 pounds without actually trying to, and her appetite has decreased. She endorsed that nothing interests her anymore and that she cannot concentrate long enough to read a magazine, let alone her textbooks. Her energy has been very low. She's not hanging out with her friends or doing things that previously interested her. So she said that things aren't fun like they used to be. So she feels hopeless, worthless, and suicidal with no plan. She has no past medical or psychiatric history, and she is not on any medications at this time. In summary, this patient is experiencing depressed mood with anhedonia, anergia, insomnia, and a decreased appetite with weight loss because she broke up with her boyfriend. She has passive suicidal ideation. Patient presents with good ruminant hygiene, mood and affective dysphoric. She lives at home with her parents. So the three psychotherapy modalities that I'm going to use to help this patient are motivational interviewing, cognitive behavioral therapy, and solution-focused brief therapy. These three types of therapy are adequate for the treatment of depression. They are integrative and complement each other adequately. So I'm going to start with motivational interviewing, which helps the patient explore her dilemma through questioning and assessing the patient's readiness for change. CBT will help the patient modify her thoughts of low self-esteem and negative core belief, and the SFBT will help the patient come up with goal of finding a permanent solution to her problems. So I'm going to start with motivational interviewing, just a brief history. So motivational interviewing actually helps the patient dig up some information. It is person-centered. It is a method that helps patients resolve ambivalent feelings and insecurities to find the internal motivation that they need to for a change in their behavior. It is practical, empathetic, and short-term. Short-term process that takes into consideration how difficult it is to make life changes. So one of the major key concepts of motivational interviewing is to understand sustained talk versus change talk. It helps resolve ambivalences. As we know, ambivalence is frequently at the heart of the patient's struggles to embark upon any kind of change. So motivational interviewing helps facilitate our clients' exploration of their dilemmas, how to reinforce change talk, and how to respond effectively when clients express their reasons for not wanting to change. So there are 5 general principles of motivational interviewing, and they include expressing empathy through reflective listening, develop discrepancy between clients' goals or values and their current behavior, avoid argument and direct confrontation, adjust to client resistance rather than opposing it directly, support self-efficacy and optimism. So OARS is a brief way to remember the basic approach used in motivational interviewing. One of them is using open-ended questions, using affirmations to recognize a patient's strength, reflection, and then there's a summary. So the next is cognitive behavioral therapy. So this model is basically used in connection with the COPE. So CBT is a form of therapy that helps a patient change their negative core belief system. automatic thoughts, and dysfunctional assumptions. CBT dwells on eliciting the patient's thoughts, feelings, physical manifestation of feelings, and behavior. The COPE sessions are in turn used to help the patient change their negative or distorted views into positive ones, leading to positive feelings and ultimately a change in behavior. Therapy sessions and homework are structured to help patients deal with their stressors and develop positive thoughts, thinking, and behavior. So during this session, we'll be using COPE, which is creating opportunities for personal empowerment. And there are going to be 7 sessions of cognitive behavioral skills building program. Session 2 is dealing with self-esteem and positive self-talk, which is what this patient will need. Some signs of poor self-esteem are going to be gone over with this patient as well. So the third therapy that we'll be using will be solution-focused brief therapy. This helps the patient focus on the solution and not the problem. My role as a provider is to assist the patient in identifying what will be happening in the future when the problem is happening less or not at all. I will also focus on bringing awareness. The role of the provider here is to help the client find those times that parts of the solution have occurred in the past or are occurring, oftentimes unaware of their strengths. Okay, so now I'm going to bring in the patient and go over these 3 modalities of therapy. So I'm going to start with motivational interviewing. Now, in motivational interviewing, what I'm basically trying to do here is find out if the patient is actually ready for change. And with this patient, this patient is African American, and as we know, culturally, they do not believe in medications. They don't trust the healthcare system that much because of what has happened in the past. So therapy will be the best thing for this patient as against using any kind of medication. So now I'm going to talk to my patient, and I'm going to make sure I have consent to go through this therapy. Okay, hello, hello, Miss JJ. My name is Anne, and I thank you for coming in for therapy today. Do I have your permission to go over some of these things with you today?
Yes, you do.
Okay, thank you very much. So I'm going to start with motivational interviewing. So I'm going to be asking some questions to help find out exactly where the patient is at this point when it comes to change. All right, so I want to thank you for being here today. Like I said earlier, it shows how much strength that you have in you. So tell me exactly what brings you in here today, what you want to achieve today.
I am not doing well in school. My grades are suffering, and I don't feel like going back to school, and I can't hang out with my friends.
Okay, so in what ways are you not doing well at school? Can you tell me a little bit more about that? Are you talking about not being able to concentrate, or is it just your grades? Are you not able to concentrate in class?
I am not able to concentrate, and I don't focus, and my grades are suffering.
Okay, so what does it feel like right now? I mean, now that you have decided to come for therapy, do you feel sad about it and you're ready to actually make things better?
I feel sad and I feel horrible about it.
Okay, I see. So if you were 100% successful in making the changes you want, what would be different, or how would things look 2 years from now?
I would like to be able to face my ex-boyfriend without feeling ashamed.
Good. That is a very good thing. Perhaps your education is very important to you, and that you don't want to give that up. So no matter what the cost is, you're going to keep going, right?
Yeah, as soon as I am successful in using my coping skills and able to deal with my feeling of shame in a positive manner.
Awesome. Okay, now I'm going to ask you what we call a scaling question. So on a scale of 1 to 10, how important is it for you to go back to school? Where 1 is not at all important and 10 is extremely important.
I would say probably 8 because I cannot see a 10 right now.
Okay, good. And 8 is doable, I think. Okay, so what do you want at this time, and where do you want to go from here?
I want to continue with therapy so that I can learn better skills to be able to handle such circumstances differently in the future.
Okay, that's awesome. Thank you very much. All right, so next I'm going to go over cognitive behavioral therapy. And like I said earlier, cognitive behavioral therapy is basically helping a patient find ways to cope, find ways to change their negative thoughts and turn them into positive ones. So we're going to use the cope session for this segment. So I'm going to be going through session 2, which is dealing with self-esteem and positive uh, thinking, self-talk, positive self-talk. So, Ms. JJ, so I'm just going to read through this quickly, and I'm going to have you participate, okay? And then at the end of the day, I'll give you some homework to help you build more on your self-esteem and positive self-talk, okay?
Yes.
So I'm just going to go over what self-esteem is. So what do you think self-esteem is?
How you feel about yourself?
Okay. And then what do you think are some of the signs of poor self-esteem? Thinking about you now.
Um, giving into peer pressure, not trying things for fear of failure, having sex, using drugs and alcohol, and acting cocky, like you know everything, being jealous, angry, and depressed.
Okay, good. That is exactly what having poor self-esteem is. So now, what are some of the signs of a healthy or positive self-esteem? I can help you out with this one a little bit. So one of the things is not being afraid to try new things. Feeling happy and confident about yourself, so that way you're able to face your friends and face anything that comes up in school. Not being overly concerned with what others think, standing up for what you believe in, and not giving into peer pressure. And there's some people often cope in unhealthy ways when they have negative thoughts and feelings, and some of these uh, they resort to eating junk food, using drugs or alcohol, smoking cigarettes, acting out in angry ways, and those are not helpful at all. So I'm very happy that you came to seek for help through therapy. Okay, so what are some positive ways to build self-esteem? Can you tell me? Can you repeat to me some of the positive ways to work on your self-esteem, or to build self-esteem?
You could do positive self-talk.
Good, good,
Talk to yourself all the time.
good. All right. So at the end of the session, I'm going to give you a homework. Okay. So when you go home today at your spare time, I want you to write down 5 people or things for which you are thankful for. Okay. And
Okay.
let's start with that. And thank you very much again for your time.
Thank you.
Okay, so now I'm done with the cognitive behavioral therapy session. So I'm going to go to the solution focus brief therapy. So I'm going to be asking some questions about what we can do today, because this is what this therapy is about. Is about the now, the here and now, to help the patient find a lasting solution to their problem. Okay, so what is your hope for today's session? Can you tell me what you hope for, what you hope to achieve
Well,
at today's session?
I'm hoping to learn ways of managing stressful situation in the future that would not lead me into depression.
Good, good. Okay, so what changes have happened or started to happen since you called for this appointment? Did you remember anything that has changed since you called for the appointment before you got here?
Oh yeah, I mean, I have been talking with my mom and my friends, and they gave me some motivation, and then I realized that I could do better for myself.
Oh, that is awesome. That is awesome. It's always good to reach out to friends and family whenever you find yourself in a stressful situation like this, and that does help. It does help a lot. Okay, so from what you're telling me, talking to your mom and your friend has really helped you, right?
Yeah.
So is that a way that you have that you have tried? Is that something that has helped you at least stop the problem from getting worse? I mean, what I mean
Yeah.
is, talking to your mom and your friend, is it one of the ways that you have come up with to help stop the problem from getting worse?
Yes.
Okay, good. So how have you been coping with all of this? How have you been dealing with, all of the stress from school and your friends? Is there anything else that you have done, especially anything like one of um, the coping measures that people go to when they go through a stressful situation, like the use of substance, like alcohol or cigarettes or any of those things, or having illicit sex? Did you try any of those? Did it get that bad?
I mean, it went bad. I tried a little puff of marijuana, but it was nothing that I did before. So, I didn't like it, so I stopped.
Okay, that's good. It's good that you realize that it's not a good coping mechanism and you actually stopped. Okay, all right. So I'm going to ask you what we call a miracle question. Okay. So suppose that tonight, while you were asleep, there was a miracle, and this problem that brought you here today disappeared. The miracle occurs while you're sleeping, so you do not even know immediately that it has happened. So when you wake up, what is the first thing you will notice that will let you know that there has been a miracle?
Well, I would feel empowered. I would not feel like I want to sleep all day.
Good,
I would want to hang out with my friends, and I would want to go to school because I love going to school. I did very well before all this
good, good. So I'm also going to ask you a scaling question here. Okay. On a scale of 0 to 10, where 10 indicates that everything you described on the day of your miracle is happening right at this moment, and 0 indicating that none of it happened, where would you be at this time?
I'll be at a 9.
Oh, you'd be at a 9. Okay, nine is awesome. Okay, so where would you like to be during our next meeting?
Probably at a 10 or 11.
Okay, so don't forget that the miracle question is talking about when all these problems disappear. Okay, so as at today, where are you on a scale of 0 to 10?
I'm like at a 4.
At a 4. Okay, so during our next session, where do you think you would want to be?
Like between 6 and 8.
Okay, that is very realistic. Okay, that is very realistic. Okay, so thank you very much again for coming, and I hope to see you again in one week. Okay.
All right,
All
thank
right.
you.
Thank you very much. All right. So in summary, this patient was referred to therapy because studies suggest that teenagers and young adults have a very high risk of suicide with antidepressants. And again, this patient is African American. They do not trust the healthcare system that much, so they would prefer not to take any kind of medication. They would prefer to just do therapy. And therapy has been proven to be very effective in helping teenagers cope with mental illnesses and behavioral problems. So the length and number of sessions is agreed upon in partnership with the patient during the first meeting to ensure and is it transitioning back into the community, and in this case back to school. And the patient has a good family support system, and she has friends that help her out as well. So then all of these are additional safety nets for this patient. So and this is the end of my presentation. Thank you.